Up next, we have a very important conversation. We don't know what course the pandemic will take in future, but we do know from the experts that taking care of our hearts right now is more important than ever. Cardiovascular disease is the #1 cause of death on the planet. What's the Ghanaian situation? It has many causes, from smoking, diabetes, high blood pressure, obesity. If you fall into this category, stay for this conversation. Let me introduce my guests. Joining us in the studio, Dr. Abdul Samed Tanko is head of Cardiology Division, National Cardiothoracic Center. Good morning to you, sir.
Good morning.
Good to have you. Also, Linda Lai is branch manager, Kasapreko. Good morning to you, Linda. Thanks for being here. When we started off the show, I was telling my viewers the wonderful thing that Kasapreko is doing through Awake, contributing to the National Cardiothoracic Center. So you will break it down for us, and I will encourage people to keep buying and drinking Awake so we can make more money and save a lot more lives. But let me start with you, Doc. Tell us about this day. Let's talk about the theme. What are we focusing on this year with the Hearts Day?
Well, good morning. Good morning to your cherished viewers and listeners. The World Heart Day was instituted in 1999 by the World Heart Federation together with the World Health Organization to raise awareness, some kind of campaign towards raising awareness about cardiovascular diseases, that is heart attacks and strokes. And it is estimated that over 70 million people die annually or worldwide with related cardiovascular disease elements. And in the year by the year 2023, which is just close by, there will be more cardiovascular deaths as a result of specifically heart attacks and strokes. This year, every year the theme varies. The theme for the celebration or the campaign varies. And this year, the theme is use your heart to beat cardiovascular diseases. And by this, the using your heart has about 3 components.
Okay.
Number 1 is to use your head. That is by using to appreciate and understand what is cardiovascular diseases and how to make sure that you prevent yourself from getting the heart diseases such as strokes and heart attacks. Then the other issue is to use your influence. That is the second aspect of the using your heart. One is your head, which you just elaborated. The other is using your influence. As an individual, you are a role model to other people, and you've got to use it to appreciate the fact that you need to help people to fight and prevent heart attacks and strokes. Then the other issue is to, as a health worker, me being a physician, I need to work alongside my patients to avoid, in a preventive way to start with, because we don't have to wait until the fellow gets ill before we step in. We need to work out when they are, to prevent getting the heart attacks and strokes. Government has to do a lot. We have so many salty foods around, but how many food will you take and see a label? The amount of grams or the grams of salt in that food is quite very appalling. Sugar and fats in our foods are quite a lot.
Do I hear you say that it's not enough to just say the sugar contained in this product, but they must tell us the quantity?
Exactly. And there must be legislation to tax sugary foods. Because we don't have that legislation. In some countries, you've got to really state. And for those, like in South Africa, for example, the amount of the grams of salt, because salt is not good for this, over consumption of salt, it worsens your hypertension for anyone who has it. So we make sure that, it's well regulated so that certain amount of salt should not be found in certain foods, among other things. And as a family member, you need to make sure that also your family, that is part of the whole protocol of making sure that using your heart to beat cardiovascular diseases. and then to make sure that in your house, people don't become couch potatoes. I mean, your wife or your partner, they should make sure that they exercise a lot. They don't sit down at one place. Children should play games. And the other using your heart is the employer. Both the public and the private sector. Mama, you will appreciate the fact that Ghanaians, we don't like going on leave, especially those in the public sector. If you say, like, if I go on leave and this contract comes, I will not meet it, and people stay on the job, and your heart needs to rest. This heart has been beating from conception. A couple of weeks after conception, the heart will start doing this way. And it beats until today, when we are all alive, our heart is still beating. This heart needs to go off some stress and go and rest. So people don't go on. People don't go on leave. So the employer must enforce this leave for people to go and rest and come back.
To protect the heart.
Protect the heart,
okay.
Exactly, yeah.
Now I can use the heart as an excuse to get my leave approved. But Linda, tell us what Awake and Effects really Kasapreko is doing differently around the theme of the celebration.
Okay, good morning, Mama, once again. Good morning to your cherished viewers and listeners. So Kasapreko, this year, as part of our education every year about cardiovascular diseases, we are dedicating the rest of the year to campaign and inform our consumers how to take care of their hearts. And so we're going to put a mini documentary on a lot of TV stations to educate our consumers on how to keep their hearts.
Okay.
Apart from that, we are also donating to the National Cardio Center, 150,000. And
dollars or
cedis.
Oliver Twist.
Yeah, in Ghana we use cedis. And also, we've started the 5 seconds awake challenge.
Okay.
When Nana Mama Brown started and passed it on to Shatawale. Shatawale also took the challenge and passed it on to Abeku Santana. Abeku Santana has taken over and is also passing on. And so we are going to, it's just to tell Ghanaians that you need to take water frequently. And so that's what we are doing to help our consumers to take care of their hearts and also to stay healthy for their hearts.
Okay. Explain why people should consume Awake.
Okay, so we started Awake in 2016 and it's the first charity drinking water in Ghana. We told Ghanaians that in the past, Kasapreko has sponsored and done a lot of CSR activities, but we wanted to do something unique for people's hearts. We wanted to be passionate about the heart because we believe that the heart keeps the human body going. And so when we started Awake Purified Mineral Water, we decided, okay, for every bottle that is purchased, we are going to put aside 1 peswa. And then at the end of a period, we put together that money and donate to the Cardio Center to help consumers or even the vulnerable in society who has the disease but cannot afford to go through surgery or treatment or whatever may be required. And so for Awake, it is all about caring for the hearts.
I have a lot of cases, a lot of patients and kids in particular whose parents cannot afford and to finance their surgeries. And
it's an expensive disease,
exactly.
They say.
Yeah, holding heart, I mean, everything is imported, everything is disposable. You can't reuse anything, I mean, during this or during and after the surgery. So it becomes, I mean, they are really handy in terms of some of these children. And let me go back a little bit to the using your heart. The last item on it is compassion. The compassion is, I mean, we need to go beyond ourselves. We need to go beyond ourselves and to help others who have this cardiovascular disease. And in COVID era, compassion has become the word. So that we have to, and people will come with so many problems as far as their heart is concerned. And that word, that last item of the using your heart, compassion, should be encouraged. And so back to Awake, they've been there always. I mean, quarterly, quarterly, some large amounts of money, I mean 40,000, 50,000 has been given to Cardiothoracic Center, and this has financed a lot of surgeries among others. And this year, this World Heart Day, which falls on the 29th, there will be a press conference at the Ghana Medical Association, and Awake will also come and donate at the center to this to help people with cardiovascular disease, especially children with holes in heart, which are the major, because the adults, most adults can afford. I mean, I'm not saying ever. Most of the cases that we see, you hardly find adults. There are some few adults who cannot afford some heart surgeries that we have. I mean, valves for them, coronary angiogram, and then other things.
But this is also not covered by NHIS?
No, unfortunately. I mean, it's NHIS doesn't come near it at all. So these are just cash. And then talking about the water is life. And so wherever you have water, you have life, obviously. And we encourage people to take a lot of water, especially with this pandemic, among other things, and those with other illnesses. But if you have issues about your kidneys and then your heart failure, you've got to talk to your doctor about excessive water intake, because that can also be, in quote, injurious of excess of water in the system. So this is amazing. I mean, but if you have heart failures or if you have kidney failure, your water intake should be regulated by your doctor. That is to clarify. All
right. I would have loved for us to continue the conversation, but because of time, we have to end it here. But we'll follow up with what you're doing tomorrow, because tomorrow really is the day. So we'll have all the conversations around it. Thank you, Linda. Thank you, Doc.
Mama V, thank you.
Thank you to Kasapreko, and definitely thank you to Awake. So if you're buying Awake, you're not just buying water. You know, you're contributing to a larger cause. And that's what I've been drinking, really. I encourage you to make Awake your water as well. I guess it's because I know where the money is going. I know where the money is going. And I'm sure some of you have also seen that in Hamilton's video. You really know that the money is going to where they say the money is going to. And that's why you must contribute. Thank you very much for your time.
Thank you.
Stay with us. We've got another conversation coming. Yesterday, was it yesterday? Yes. A new queen was crowned, Miss Universe 2020, in a way that we haven't seen before. She's on the show with Cardi up next. Stay with us.